joining us today. I'm going to talk about something important for men, which is every man would not like to wear diapers and every man would not like to be impotent, right? I mean, all men would definitely say so. So unfortunately, prostate cancer treatment sometimes can cause the issue that men do not want. So I'm going to go through how to reduce the side effects and what are the new things. I'm going to share my slides. Today, I'm going to talk about reducing impotence and urine incontinence for patients with localized prostate cancer. And these are the new treatment options that are available, and I'll discuss some of the options that are available in Singapore. These are my panel that I have for insurance in Singapore. So I'm on the main panel for almost all the insurance, thankfully. Today's talk is going to be on outcome of prostate cancer. What have we learned over the few decades of learning? What is focal therapy? And when is it useful for localized cancer? In Singapore, we have known that for some time that the prostate cancer is the most common cancer in men in Singapore. It's number one. It's even more common than colon cancer and lung cancer for men. This is found in the data from Singapore Cancer Registry. And we know that in Singapore, the Chinese population have a higher incidence of prostate cancer compared to other racial groups in Singapore over our last 50 years. Unfortunately, everybody wants to know whether men have symptoms when they have cancer. Unfortunately, the answer is most men do not have symptoms. Sometimes when they have symptoms, it may be a late stage. For example, they may have urine difficulty, even blood in urine. They may wake up at night to pass urine or go to toilet often, and some of the symptoms that we list here. And the key question every patient asks is, how come I don't have symptoms? That's because prostate cancer do not cause symptoms in the early stage cancer. When we review the Singapore data over the last 50 years, even until now, 30% of patients walk into my clinic are already stage 4 and they are terminal. We really don't like to see this information because it's very easy to do a health screening and do a blood test called PSA in any laboratory, any clinic, we can do it just to detect whether someone has a chance of cancer. We don't have to see 30% of patients already with stage 4. And I hope this will change in the coming future. What is interesting is that there are more and more patients who are younger and diagnosed with cancer. When you look at a global trend, for young adults younger than 50 years old, the early onset nasopharyngeal and prostate cancer has been increasing at the fastest rate. So remember to look for prostate cancer even in the 30s or 40 years old. Some patients have asked me, doctor, if I have an early stage of prostate cancer, can I just leave it alone? You know, I have no symptoms, I feel fine. Some of the Google articles I read say that, oh, prostate cancer is harmless, just leave it alone. When you actually look at the 15-year follow-up for patients who go and they are randomized to active surveillance, prostate surgery or radiotherapy, what they found is that after 15 years, people who do not do anything when they have observation, the death rate is similar, but they have a higher chance of cancer spreading to the bone, metastasis, or clinical progression. No matter what outcome you look at, whenever you do active monitoring, even though they have similar cancer-specific survival, they have higher chance of spread to the bone or other organs. So there will be some worry about patients when they have early stage cancer, whether they should do something or leave it alone. But there's always a middle ground. Maybe we can treat just the cancer part and do not have radical treatment that cause side effect. These are the few treatment options for prostate cancer. If you look on the left-hand side, early stage cancer, you can do surgery, radiotherapy, or simply active surveillance. But now there's a middle of the road option where you can do something about it and has less side effect. They are called the focal therapy. And in Singapore, these three options are available. One is called HIFU, one is cryotherapy, and one is nanoknife. And from this talk, I'm going to give a discussion about each of these therapy. We know that in the past, we used to do an open surgery where the scar from the operation is from the belly button downwards towards the penis. Then we have progressed and improved to use keyhole called laparoscopic. But the latest machine that we use now is called intuitive Vinci robotic system, where almost every urologist use it for surgery. This was me when I was younger in 2009 when I was training in New York. On the left-hand side, I'm doing the operation under the guidance of my mentor, and I need to remember every instrument there, and I'm doing the surgery. And at the same time, I was also doing the robotic surgery even then, and we can toggle and switch between the machines. So nowadays, as I told you, majority of the surgeons use Da Vinci robotic surgery on the right-hand side. Why do focal therapy then? Because no matter open surgery or robotic surgery, we have to remove the whole prostate and cause men to be incontinent, and they need to wear diapers, and they also become impotent and lose their erection. How about focal therapy? We can simply find out the area of cancer, like the ones in the black areas, black dots, and then we can focus the cancer treatment. If the cancer is in one area, treat one area. If it's two area, treat two area. Why remove the whole thing when the rest of the areas are normal? Why don't just treat the cancer? Which is what focal therapy tries to do. Just focus on the cancer and treat it. Give you some examples of the energy devices we use. The first one is HIFU, high intensity focused ultrasound. Remember when you are young, you use a magnifying glass and you shine the sunlight onto a leaf, the leaf will actually burn. That's because the focus point of the energy is focused on the leaf and it will burn, it's so hot. So when you use ultrasound, when you use HIFU, the point maximum focal temperature can go as high as 85 degrees Celsius. That will kill off all the cancer cells that are focused with the focus energy. And if you look at number 3 on the tissue effect, immediately the cancer cells will die. After 7 days, there will be some inflammation, and by 14 days, there will be fibrosis that set in. The second energy device used for focal therapy is using an ice ball. We use argon gas exchange with helium through a cryotherapy needle. We freeze the area to minus 40 degrees Celsius and warm it, freeze it and warm it. And all this freezing and warming cycle will destroy the prostate tissue. Of course, when we put the ice into the prostate, we must keep the urethra warm and rectal warm so that there's no unnecessary damage to the surrounding area. The third energy device that we use is called nanoknife irreversible electroporation. What it does is simply using electricity to cause small little nanopores in a cell membrane, and this will disrupt the osmotic exchange. And what happens is that the cells will die. And this is the latest nanoknife technology that is used to kill prostate cancer. So the next question will be, is focal therapy useful for localized cancer, and when is it suitable and when is it not suitable? Because we must select patients carefully. We look at focal therapy in these few areas. Number 1, patients will have better outcome if they are in the low risk and intermediate risk prostate cancer category. The second group of patients that will benefit are patients who already have radiotherapy in the past, but cancer come back again. So when the cancer come back again after radiotherapy and the cancer is still within the prostate, we can treat the patient with focal therapy. So in Singapore, we do these 3 energy devices. So let me first summarize and highlight what is HIFU. As we know, in HIFU, we take ultrasound to focus onto a pinpoint area to heat the area up to 85 degrees Celsius. In Singapore, we've been doing that since before COVID, so it's about 5-6 years already. We treat the patients through different protocol, either the hemiablation, whole gland, or focal therapy onto the prostate cancer. If you look at the worldwide study, including one of the better research groups in London, University College London, they took out of all the patients, 100% of patients are alive from prostate cancer treatment using HIFU. 88% don't need other treatment, and 98% actually do not need to wear diapers. This is compared to every single man wearing diapers after robotic surgery. Although they recover, they need to wear diapers at least for some time. And men don't like to wear diapers. For HIFU, 98% don't wear diapers, which is a happy thing for very many men. And when you look at 15-year experience in UK, we tell patients that because we only treat the cancer area, the remaining area of the prostate, sometimes cancer can come back. But the good news is, out of 100 patients, 70% of patients will not need another treatment in 7 years. Maybe 30% may need a second treatment. Of course, a patient can go through a second HIFU again. And if not, they can always go for surgery or radiotherapy. So there's always an option, a second option if cancer come back. And many patients ask me, oh, is it a new research? We never hear about it in Singapore, elsewhere. Well, around the world, there are many long-term data, 10 years, 15 years. And then this year, all this data shows that almost 90% of patients survive and more than 10 years. And interestingly, there's already a 21-year follow-up. How many cancer study do you see having 21-year follow-up of patients who undergo treatment? And we have seen data published for 21-year follow-up where we learn how to treat cancers properly and which patients are suitable. So from this particular study, we found out that the 15-year cancer-specific survival and metastatic-free survival is good for low and intermediate. But patients who have high-risk cancer, maybe their cancer come back much faster compared to other groups of patients. No matter what they study in this report, all the high-risk patients do have a higher chance that cancer can come back. So nowadays, we have learned to do it in the appropriate patients, and we select patients carefully before we do HIFU. How about patients who had radiotherapy before in the past and want to do HIFU? Well, we can find out that many patients, a suitable number, will reach a nadir PSA of less than 0.5, which means the cancer is almost gone. And the HIFU can treat the cancer even though it has come back. Same around the world, people have used it for patients who had radio recurrent prostate cancer. And what's exciting, last year, this was published and presented at American Uro Association in San Antonio. And this is one of the largest worldwide trial in France where 46 centers were involved, and they compare HIFU versus robotic and open or laparoscopic radical prostatectomy. So you either do surgery or HIFU for patients with low risk and intermediate risk. What did they find? They found that both treatment, whether you do HIFU or you do surgery, they have similar salvage therapy-free survival. But HIFU have the advantage of having less urine leak and less erectile dysfunction. So in France, this is very important. I'm sure in Singapore too, that men do not like to wear diapers and men do not like to be impotent after prostate cancer treatment. When you look at the data in the French study, patients who may need a second treatment, even if cancer come back, are almost similar, no matter whether it's HIFU or prostate. So the cancer outcome seems to be similar, and HIFU has less side effect. What is interesting is that if you look around the top centers and cancer centers in America, this is the US map, all the top cancer centers on this map have been using HIFU. So it's not a new treatment and it's not an experimental thing. And you look at the top cancer centers like Cornell, in Memorial Sloan Kettering, and MD Anderson, UCSF, USC, these are, and Mayo Clinic, Henry Ford, these are the top cancer center, Cleveland Clinic. So it's not new. So we are very fortunate to have started this since before COVID. And this is our data in Singapore, where we presented this in the 14th International Symposium of Focal Therapy last year, where we look at our 5-year report, where patients, youngest is 46 and our oldest man is 88. And it can be done as a day surgery. Patient do it in the morning and go home for dinner. And these are some of the early complications we see with recurrence rate of 17.8%. And this data is similar to many published reports around the world. This is an example, a case study of my patients. He's a 54-year-old gentleman with a PSA of 5. and having a Pirates 4 lesion in a prostate. And as you see on this map, this is his actual biopsy map. Every single dot there is the needle mark we put in. So now, because of MRI ultrasound biopsy that's more accurate than before, we are able to pinpoint each and every single core, whether there's cancer or no cancer. So we can tell you this is cancer or no cancer. And once we find cancer area, we will only focus on it. For this patient, we found that the patient's left side of the lobe, the orange lesion has cancer, and surrounding it, there's cancer too. So we also actually find out there's cancer in the orange and non-orange area. So what we decided to do is treat half his prostate to make sure all the cancer is gone. This is him in the operating theater. This is our setup. On the left-hand side is where patients will lie down, and ultrasound probe on the bottom left-hand corner is what is placed in the rectum. During the treatment, we decide to look on the left lateral lobe, and this is the program we use to decide a treatment. And the safety parameters on the bottom right-hand side. And during the surgery, if you look at the marking, every red color dot in the TV camera is a treated area, green is waiting. So every treatment is reaching 85 degrees Celsius to kill out the cancer cells. The patient was very happy. He went home on the same day and has dinner with his wife at home. So this can be done as a day surgery now. From what we have seen in our patients in Singapore over the last 5 years, advantage of focal therapy is that they really have very minimal erection problem or urine leak. Of course, the disadvantage of HIFU, we have to tell everyone, we only treat the cancer, but the remaining part of the prostate can always have cancer coming back. So we tell them at 5 years, up to 10 to 20% of patients may recur. But don't worry, even if you recur, you can do another HIFU, just like the French study, or you can proceed to surgery or radiotherapy, and it allows you to have the treatment if you want to. Let me go through the other energy modality that we use for focal therapy. Is called nanoknife. It uses electricity, as I mentioned, where we use monopolar needle electrodes with an electrical generator. I have a video here to show you how it works.
Ablation therapy is a localized, minimally invasive treatment. During ablation, thermal energy is delivered to diseased tissues, causing cellular death through heating or cooling the tissue to cytotoxic levels. However, thermal energy causes the nonspecific destruction of both cellular and noncellular contents. This leads to the destruction of the extracellular matrix and the potential damage to vital structures. Fibrotic scarring then follows, impacting tissue function. Furthermore, large blood vessels close to the targeted tissue can cause a heat sink effect, which reduces the ability of the ablation technique to successfully eradicate the diseased tissue. The nanoknife system harnesses the power of irreversible electroporation to effectively destroy diseased tissue without the need for thermal energy. 2 to 6 minimally invasive needle electrodes are positioned in or around the diseased tissue using real-time ultrasound guidance or computed tomography. High-voltage electrical pulses are delivered between the electrodes and can be confidently delivered in all segments of an organ. This creates irreversible nanopores within the cell membrane. This stimulus induces an apoptotic-like cellular death, resulting in the complete ablation of tissue within the electrode configuration. Body responds with the removal of cellular debris. Delivery of non-thermal energy ensures the conservation of the extracellular matrix. The unique mechanism of action enables the preservation of vital structures inside the ablation zone, facilitating the histological and functional regeneration following treatment. The nanoknife system reimagines localized therapy improving precision, increasing preservation, and expanding versatility to ensure treatments can be tailored with confidence.
So when we look at HIFU versus NanoKnife, there are systematic literature review to look at 55 publications and compare the differences between HIFU and NanoKnife. HIFU is much better at reducing make sure there's no urine leak and less treatment complications. For NanoKnife, it's better to have lesser chance of infill biopsy cancer, and also better for erection as well. So there are advantages and disadvantages of both type of modality. So patients in Singapore, we do the same thing, just like this video.
The NanoKnife system is the only function-preserving therapy that uses electricity to destroy prostate tumors. The procedure takes about an hour and has minimal recovery time. During the procedure, electrodes will be placed to bracket the targeted prostate tumor. The physician will use ultrasound to guide the placement of the electrodes. This therapy precisely targets the prostate tumor with electrical pulses that destroy cells. Talk to your doctor to see if you are a candidate for the NanoKnife system procedure. Use the physician locator to find a physician.
So that's how it's done. So this is one of my patients, and that I did in Farrer Park Hospital. This is me putting the needles in. Can you see the video, Teddy, and the sound?
Yes. Can see the video and the sound.
And this is a top view where the needle goes in. Needle goes into the right place. We use the ultrasound to make sure the needle goes exactly to the place where we want the tumor to be treated. During the treatment, we will monitor the patients under general anesthesia. With electric currents, the prostate will be treated. So, is focal therapy useful for all? Not everybody will be suitable. So it's more important to discuss with the doctor which cancer treatment is suitable. But focal therapy is definitely one of the choices that's available for patients who do not want to wear diapers and do not want to lose their erection. And patients will often ask me, so doctor, what do you choose? And I actually tell them this, smile. What does it mean? I ask them, do you want to be happier? Why do I ask this? Because remember, every prostate cancer treatment has different side effect profile. And I tell them about this. There's a Harvard study from Harvard Medical School since 1938. Over the last 75 years, they only want to know how to be happy. And this is the longest study on Earth over the last 75 years on human life, 75 years. And what did they find after 75 years? All they tell us is that good relationships lead to health and happiness. It's not the cancer, it's not whether someone has cholesterol or whether someone has diabetes, but it's good relationship. So if you allow me, I'm going to share, and this is Professor Waldinger, the director of Harvard Medical School, who does this.
Healthy and happy as we go through life. If you were going to invest now in your future best self, where would you put your time and your energy? There was a recent survey of millennials asking them what their most important life goals were. And over 80% said that a major life goal for them was to get rich. And another 50% of those same young adults said that another major life goal was to become famous. And we're constantly told to lean into work, to push harder and achieve more. We're given the impression that these are the things that we need to go after in order to have a good life.
Let me show what he has found over the last 50 years.
So what do we learn? What are the lessons that we learn from the hundreds of thousands of pages of information that we've generated on these lives? Well, the lessons aren't about wealth or fame or working harder and harder. The clearest message that we get from this 75-year study is this: good relationships keep us happier and healthier, period. We've learned 3 big lessons about relationships. The first is that social connections are really good for us, and that loneliness kills. It turns out that people who are more socially connected to family, to friends, to community are happier, they're physically healthier, and they live longer than people who are less well connected. And the experience of loneliness turns out to be toxic. People who are more isolated than they want to be from others find that they are less happy, their health declines earlier in midlife, their brain functioning declines sooner, and they live shorter lives than people who are not lonely. And the sad fact is that at any given time, more than 1 in 5 Americans will report that they're lonely. And we know that you can be lonely in a crowd and you can be lonely in a marriage. So the second big lesson that we learned is that it's not just the number of friends you have, and it's not whether or not you're in a committed relationship, but it's the quality of your close relationships that matters. It turns out that living in the midst of conflict is really bad for our health. High conflict marriages, for example, without much affection, turn out to be very bad for our health, perhaps worse than getting divorced. And living in the midst of good, warm relationships is protective. Once we had followed our men all the way into their 80s, we want to look back at them at midlife and to see if we could predict who was going to grow into a happy, healthy octogenarian and who wasn't. And when we gathered together everything we knew about them at age 50, it wasn't their middle-aged cholesterol levels that predicted how they were going to grow old. It was how satisfied they were in their relationships. The people who were the most satisfied in their relationships at age 50 were the healthiest at age 80. And good, close relationships seem to buffer us from some of the slings and arrows of getting old. Our most happily partnered men and women reported in their 80s that on the days when they had more physical pain, their mood stayed just as happy. But the people who were in unhappy relationships, on the days when they reported more physical pain, it was magnified by more emotional pain. And the third big lesson that we learned about relationships and our health is that good relationships don't just protect our bodies, they protect our brains. It turns out that being in a securely attached relationship to another person in your 80s is protective. That the people who are in relationships where they really feel they can count on the other person in times of need, those people's memories stay sharper longer. And the people in relationships where they feel they really can't count on the other one, those are the people who experience earlier memory decline. And those good relationships, they don't have to be smooth all the time. Some of our octogenarian couples could bicker with each other day in and day out. But as long as they felt that they could really count on the other when the going got tough, those arguments didn't take a toll on their memories. So, this message that good, close relationships are good for our health and well-being, this is wisdom that's as old as the hills. Why is this so hard to get and so easy to ignore? Well, we're human. What we really like is a quick fix, something we can get that'll make our lives good and keep them that way. Relationships are messy and they're complicated, and the hard work of tending to family and friends, it's not sexy or glamorous. It's also lifelong. It never ends. The people in our 75-year study who were the happiest in retirement were the people who had actively worked to replace workmates with new playmates. Just like the millennials in that recent survey, many of our men, when they were starting out as young adults, really believed that fame and wealth and high achievement were what they needed to go after to have a good life. But over and over these 75 years, our study has shown that the people who fared the best were the people who leaned into relationships with family, with friends, with community. So what about you? Let's say you're 25, or you're 40, or you're 60. What might leaning into relationships even look like? Well, the possibilities are practically endless. It might be something as simple as replacing screen time with people time, or livening up a stale relationship by doing something new together, long walks or date nights, or reaching out to that family member who you haven't spoken to in years, because those all too common family feuds take a terrible toll on the people who hold the grudges. I'd like to close with a quote from Mark Twain. More than a century ago, he was looking back on his life, and he wrote this: "There isn't time, so brief is life, for bickerings, apologies, heartburnings, callings to account. There is only time for loving, and but an instant, so to speak, for that. The good life is built with good relationships." Thank you.
I tell patients this: if you decide to choose focal therapy, you must also look after your relationships and yourself. Then you'll be happy no matter what the blood test shows for your PSA and prostate cancer. And I teach them smile, how to do self-care, how to make more friends or keep up with old friends, have inner peace that you accept what you have, love others, and exercise. When you do this, if you do focal therapy or any treatment you decide, you'll be a happy man. You'll be in a good relationship and you will have peace. So I learned a lot from my patients and also their family member when I run prostate cancer support groups in the Singapore Cancer Society and elsewhere. And that's why with their experience, we have started a program called Dr. Heals, where people can look after themselves. And we started this in Chiang Mai to do wellness retreats so that people have reduced stress and reduced burnout. And if you have patients who want to reduce stress or reduce burnout, see whether this is suitable for them, drheals.com. At the same time, we want to tell patients that we need to have proper medical information. Don't just Google and Facebook any medical condition and think that that's something they must follow. So because they may be fake news in some of those articles. So we also started asiamd.com, where we provide healthcare articles, wellness tips, and health tips in English and Mandarin. So if your patients want to search some healthcare information, free of charge for them, is asiamd.com. With that, I thank you very much for listening and giving me the chance to share about focal therapy in prostate cancer, and may God bless you. Thank you very much. And you can reach me here from my email. When somebody has a low-grade prostate cancer, actually, I'll prefer them not to do anything if possible. Because remember, prostate cancer can be growing very slowly or very fast or intermediate. So we always decide low, intermediate, or high risk. for patients who have low and slow growing cancer, active surveillance is one of the management option for patients as well. So I'll tell them, are you comfortable watching and just check blood tests? If not, would you like to have treatment? If you want to have treatment, you want to have a radical treatment where there's a highest chance that cancer don't come back, or the middle of the path, focal therapy, where there's still a little chance cancer come back, but you have good quality of life for many years. And if you are lucky, out of a majority of patients, you don't need any more treatment forever. So I always ask them, what do they want? Are they happy with their life? And what do they want to achieve?
Mainly have a smile, be happy.
Definitely, yes. And for, I guess the question is whether it's nano knife or HIFU. I think both have good and bad points. I normally look at the size of the prostate, the location of the tumor, and also whether the patient had other medical problems. But both of them can be done as focal therapy. So thank you for everyone's time. If there are no other questions, do feel free to email me at Surg10 or can find me. Yeah, thank you very much.